All right.
Okay, so can you tell me a little bit about CLS and
Sure.
what it entails?
Sure. So the career, right?
Mm-hmm.
So we are the folks who do all of the laboratory testing that is requested on patients by their physicians. And so we can take things like blood, urine, swabs from a wound or a throat or whatever the case may be, and we can perform a variety of tests on those specimens to identify what microorganism is growing, and causing you problems, or, looking at your blood cells to see if they look normal or not, or if there's enough of them. Sometimes you have problems if you have too few or too many, and so we can do all of those things. We can look at a lot of different chemicals inside your body that should be at certain levels, and when they're not at those levels, they can cause problems. So physicians will order these tests on their patients to try to figure out what's going on inside their body, and once they've got that figured out, then they can decide on a course of treatment for that patient. And so in that sense, we have a lot to do with patient care. It's just that we often don't see those patients. We just receive the specimens in the laboratory, do the work, and report back out to the physician.
Okay. And you said that they work with the diagnostics team. Who else
Yes.
do they usually work with?
Well, I would say all of the X-ray and the imaging folks also provide a picture, literally, of what's going on inside the body as well. And so usually, physicians, when they are trying, a patient comes to them, I'm having XYZ problem or symptom or whatever, they'll use lab tests and imaging studies and that sort of thing to try to figure out what's going on inside, because of course you don't ever want to just revert to opening somebody up surgically and looking inside. we want to avoid that whenever possible,
we want
right?
to know what's going on.
So I would say that the physician, the imaging folks, the lab, and then any of the other folks that are involved in helping the patient, nurses and such, we're all part of that team. And that's why, like, in my presentation, it made sense that to discuss it in those terms, because all of the imaging folks, you were all sitting in the room because you were hoping to potentially be in the imaging sciences at some point. We work together frequently, and I think I may have mentioned that in some settings they may ask for somebody who can do both, the clinical laboratory stuff and the imaging stuff. And now it's not like you're going to be double boarded, if you will, in lab and ultrasound. It's usually X-ray and lab are coupled together at some places.
Okay. What is the course like here?
So the courses are, I describe the degree program as a 2+2 program, where the first 2 years of your bachelor's degree, you're working on prerequisite courses and some of the general education requirements that are true to any degree. Then you apply in the spring of your sophomore year to enter into the professional program. And then you start, assuming you get accepted, you start the professional program the fall of your junior year. And so then that first year in the professional program, so your junior year, you take tons of face-to-face classes, all with labs. It isn't clinical laboratory science for nothing, right? And then in your senior year, you're doing your clinical rotations out at various hospitals and clinics in the Northeast Arkansas area, and taking online classes towards your degree concurrently.
Okay.
So.
Okay. And then can you tell me a little bit more about the basic principles of CLS and when the best time to take that is?
It is offered in both the fall and the spring. They're identical, so I don't know that there's any best time to take it. It is required before you take the professional component of the degree program, so it basically you have to be done with that class or in progress with that class when you apply to the program. And it is a very broad course that obviously tells you about CLS, the different disciplines within CLS, and basic laboratory safety and procedures. You learn basic laboratory math, and you also learn how to perform phlebotomy or drawing blood. And that's actually a pretty big component of the class. And you first practice on fake arms and, fake veins and such, and then you do move towards poking each other, and then friends and family if you need to. I mean, so it's actually a really good skill to have regardless of what medical major you pursue, but it's also one of those skills that is something you can get a job with too. I mean, so some of the hospitals and clinics in town may even hire you based on that little experience in class of performing phlebotomy, and you can get a part-time job doing that.
I think that'd be really neat.
It is, because that's when you do get to see the patient.
Yeah.
And so nobody likes to have their blood drawn, right? I mean, you don't ever see anybody raising their hand like, pick me, pick me. So it's extremely important for us as laboratorians to make the patient feel comfortable and confident in you, in your skills, but make them feel comfortable with a procedure that is not enjoyable for anybody. So that's where, a compassionate attitude and patience and gentleness is really important.
Okay, and is that a class you can take your freshman or sophomore year?
Yes.
Because I was actually thinking about taking it my freshman year, just
Sure.
so I had an idea of what to expect.
Absolutely.
Okay.
No, we'd be happy to see you next spring.
Okay. My two interests are really in lab work and in research.
Okay.
So can you tell me a little bit about each one?
They go hand in hand. They really do. So a lot of research involves lab work. So a lot of the techniques that you're going to learn in clinical laboratory science are going to be directly applicable to doing research. A lot of research, depending on the specific type of research, is going often down to the molecular, cellular, DNA level, and sometimes even smaller than that. But the techniques that we teach you in clinical lab, oftentimes some of those techniques that are very researchy are actually being done in the clinical setting. And so, I mean, they really can go hand in hand. It just, when it comes to research, I think you just have to figure out what you want for, a career in the future. So, research is often performed either in an academic setting, like at a university, or it's performed more in like a research and development type of setting, like in industry, trying to figure out new ways to test for things or a new drug for this condition or whatever the case may be. So a lot of time, I don't know that I'm necessarily creative enough to be in research, because you have to be extremely curious in research. You have to be thinking about questions that you want answered all the time and how you might go about answering those questions. Like, how are you going to tweak that to figure that out? And so, and also for research, you have to consider that you will probably need to get an advanced degree.
Yeah.
Unless you just want to be the worker bee doing the laboratory work the entire time, you're probably going to need at least a master's, if not a PhD, to be the true thinker of the group, developing new tests and kind of leading a research team. With clinical lab science, you'll definitely be employable in both settings, research and in the clinical world. But you can make a pretty decent career without ever having to get another degree in the clinical lab world. So, you just kind of have to weigh how much time you want to spend in school and what your personality type is like and what you're capable of and all of that. So,
are there any minors you would suggest getting with this degree?
Well, some of the minors that some of our students have gotten are chemistry, biology. If they do have true intentions to go into the more clinical world, there's a very popular minor offered in our college called Disaster Preparedness and Emergency Management.
Okay, I think I've heard of that.
Probably heard of that. And, basically pointing to the fact that even though emergencies and disasters don't target certain populations or anything, it's in the healthcare setting, there's often a very clear-cut committee that's making these plans for what if disaster strikes. What are we going to do if we lose all the power to the hospital and we have, what's going to happen next, or if the hospital gets leveled by a tornado or whatever the case may be. So being able to think about those types of questions and make a plan for what to do if it were to happen, that's a really good skill to have. I'm not thinking about, you can really minor in just about anything.
Yeah.
Seriously, like if you love history or something like that, you could potentially get a minor in history. But the ones that are more relevant seem to be the disaster preparedness and the chemistry and the biology, that sort of thing.
Okay.
Excuse me.
What advice do you give anyone wanting a career in clinical lab science?
Well, first make sure that it's what you want to do, that you like biology, you like chemistry, you like working with your hands in the laboratory setting, and that you don't mind the fact that you won't have the one-on-one patient contact. A lot of times I feel like when somebody is considering this degree program, they know they want to be in medicine, they're not really entirely sure where they want to go with that, and that's usually, I think, a major deciding factor. You know, how important is it to you to work directly with the patient? And if that's not a big driving factor for your happiness, well, then this could absolutely be, you know, a great choice to make. And you know, the opportunities to move up in the world are certainly plentiful in clinical laboratory science. So, you know, just being you pay attention to detail, you are very organized, maybe borderline OCD. I mean, I realize my desk doesn't indicate as such, but you have to be extremely precise and accurate when you do laboratory work. And so if that's kind of just already part of your personality, you're very, you know, very thoughtful about everything that you do, and you're not sloppy and whatever. Those are some personality traits that I think lend themselves to being a good candidate for this field.
And do you think the basic principles would help someone decide if they wanted to do?
I think it does a pretty good job of giving you a pretty broad overview of the field and the different disciplines and kind of what's going to be expected of you in the real world. I think it's gonna help a lot. One thing that I'm kind of hoping to add to that class in the future is an actual tour of one of the local laboratories, because I feel like all too often our students, you know, get through their campus training, and we try our best to simulate as best we can what it's like in the real world, but, you know, dollar limitations, space limitations, that sort of thing prevent us from making it exactly like the real world. And so sometimes I think people are surprised a little bit by what they see when they go out on their first rotation, and not that they dislike it, it's just different and surprising and maybe just a little bit like, whoa, okay, I kind of got to shift gears here. So one of the things that I'm hoping to add to that Principles of CLS class is one day where we all go on a tour and get shown, like, here's a real live living, working lab, and here, you know, so being able to look around and talk to some of the employees and see what they're doing and that sort of thing. So
yeah, I think shadowing would also be really beneficial.
A lot of times shadowing is when we could identify people who might be willing to allow you to shadow. It's just that that's a lot of appointment making to do, and so sometimes it falls on the student, like, I want to shadow, so I'm going to call so-and-so and see if I can't follow them around for half a day or whatever. And so that's what, I mean, I feel like a tour will get more bang for our buck, but if you really want to live it, breathe it, follow somebody around for a day or so. And do you know anybody who
actually
is in this line of work?
Not really. I'm from Illinois.
Okay,
so,
that's okay. We won't hold it against you. I'm from Wisconsin, so, you know, we're neighbors.
Yeah. Well, I shadowed somebody. For a while, I was interested in working in the NICU. So I followed or shadowed somebody at one of our local hospitals, and that was really cool.
I'll bet it was.
I mean, you had to experience a lot, and it was like a reality check. Like,
did you decide then you didn't want to do that?
I'm like, okay, this might not be for me.
I'm not certain that I could handle the emotional stress of any line of work that does involve patient contact. And in healthcare, people are going to die every day, probably.
Yeah.
And I don't know if I could handle that part.
Yeah, well, with the NICU, like, I knew babies are, like, some of them are really small. And when they say they're under a pound, like, I picture that, but I don't really picture, like, their heads, like, the size of the rest of their body. And, like, it's like, I can't do this.
Can't
like,
do
it's
this.
heartbreaking.
Done.
Yeah.
It's good to figure that out on the front end, yeah.
Yeah. When did you know CLS was for you and you wanted to work in the environment?
Well, I didn't know about CLS when I came to college. I had been kind of thinking medical school, and I had been shadowing a doctor in high school to kind of see if I would like that. And so I came into college as a biochemistry major, just choosing, any random science to push forward towards medical school. And I don't know, pretty early on, like during my freshman year, I was kind of like, I don't know if medical school is really what I want to do, and not really liking this whole biochem thing. It's not that I dislike biochemistry, it's just that, I don't know, I just didn't think it was for me. And so I actually went back to the doctor I had been shadowing and kind of expressed those feelings to her and asked for some advice, basically. And that's when I found out that she was a clinical lab scientist first, and suggested that I look into it. And sure enough, the university I was going to had it as a program, and so I switched my major and got into the program without losing any ground. Like, I made that decision soon enough so that I didn't have to spend any extra time in college to get it done.
Yeah.
So,
I had never heard of it until you came in, but
it's very, very common. But it's mostly because when you think about just the general public and their interactions with healthcare, I mean, I think they peripherally know that there's a lab. They get, well, you're having labs drawn today, or this is being sent to the lab, but they never really think about who's running in there, who is in there, right? I mean, maybe it's some magical place. I mean, we in the lab now, to the public, we describe the lab as a black box. I mean, that's how the public sees us, because they don't really see what goes on in there ever, nor do they really see the people that work in there. So, I mean, I think there's some mystical magic involved in there or something in the public's eyes, because they never lay eyes on us. And so I think it really stems from that far back. It's not so much that we're doing a poor job at ASU of recruiting people to our program. It's just like, I mean, you have to come past our table, and you have to, if you're being shuffled around who knows where, you might just see clinical laboratory science. Well, I don't know what that is, move on, so it just, these opportunities where I get to come and tell you guys about it, I have been taking every opportunity I've been given, trying to anyway, just because I get a lot of that. I've never heard of this before. I didn't even know this profession existed.
Yeah.
It's very common. So we're even trying to go a step further, and when we can work it out, try to get into the high schools. Like, I know a lot of high schools offer, health professions type classes, or, intro to medical field or whatever kinds of classes. So when we hear about that, we try to offer up, our time and effort to come to that classroom and talk to those students who are interested in a field, a job in medicine somewhere. And, they've never heard of us either.
Yeah.
So it's pretty typical.
Yeah, I'm definitely intrigued by it, but I actually have an appointment. Oh, shoot. I think it's next Thursday. I think I am going to actually switch a major then. But then after I do that, who would I need to sit down with to talk about classes to take?
Miss Long. Miss Valerie Long.
Okay.
So probably the same person you've been working with all along. She is our pre-professional advisor for all the imaging programs, for us, for dietetics, for health studies. I mean, kind of all of the, I call them miscellaneous majors, like non-nursing majors pretty much in this college. So she'd be able to help you switch gears in that respect too.
Okay, I think it's actually my appointments with the switch my major.
Perfect.
But then, okay, so I printed off this,
what is that?
the classes.
Yeah.
And I marked off the ones that I've already taken, and like I highlighted in yellow the ones I plan on taking in the spring.
Okay.
Which one of these would you suggest taking in the spring of my freshman year?
Gosh, either or. Honest to goodness.
My nursing advisor
said don't do this and this together. Mm-hmm.
So that's why I was kind of looking towards the principals of CLS.
Well, when another gal from nursing came in and told my FYE class the same thing. It wasn't Miss Ray. She did say that, but then I had a nursing faculty member come and talk to my FYE class the other day, and for the nursing application, that's a June thing. Like already next June, if you were going to pursue nursing, you would be applying next June.
Yeah.
And so her argument was to not take 2 science classes in the spring leading up to that, because the likelihood of maybe not doing as well trying to juggle both is there. And so she would prefer that you just do 1 science class and then take, the other prereqs and other general studies or whatever, in an effort to keep your GPA as high as possible to increase your chances of getting in. If you have like almost zero intention of pursuing nursing anymore, then I don't know that advice is as solid, because it also kind of depends on the student.
Yeah.
I mean, taking 2 lab classes in any given semester is a lot to do. I mean, the fact remains is that labs take more of your time, and so you've got, whole afternoons or whole mornings devoted to being in this one class, and they're a lot of work. I get that. But if you're pursuing, something like CLS or something like the imaging studies, I mean, labs are going to be your whole life
Yeah,
when you
I
get
saw
there.
that, like,
and so,
junior year.
yeah, I mean, like, everything you look at here has a lab associated with it. It makes sense because of what we do for a living, but I mean, so my argument is that if you're fairly strong as a student, you've got your study habits figured out, you haven't really been struggling per se in A&P 1, my thought would be to do both, especially if you have no intentions of, putting in an application to nursing in June. B's are great for us. A's are better, yeah, sure. C's, I will say that our program is, we don't have nearly as many applicants as like nursing and the imaging studies have and stuff like that for the same number of spots. Like we still take about 30 students a year, but we at most have 50 applicants. So it's not like there's triple the number of people applying for spots. So, and I, again, don't want to suggest that means we're easier as a major. That is so not true. But I think, if you can show that you can tackle a couple of lab classes in the same semester, and if you feel confident, I don't know how A&P 1 has been going for you, but if it's been going fairly well and you're getting the hang of the whole studying thing, and you really aren't thinking about nursing anymore, I think you could probably manage 2 of them. And as far as which, oh gosh, I mean, this one you could take just to know,
for sure.
earlier, I guess, if this is the right path for you. It might be a hair easier than micro. It's less credits. I mean, we only have a 2-credit lecture and 1-credit lab versus the 3-credit lecture. So, but honestly, it could really go either way.
Okay, well, I'll probably look into both, and then
it might come down to which one fits in your schedule.
Yeah.
Micro's going to have more opportunities for lecture times and lab times than principals. Principals is just the one time. And we have two lab sessions to choose from because we want fewer people in the laboratory at each time, but we only have 1 lecture and then just the 2 lab sessions. And micro might have 1 huge lecture, but then like 8 different lab times to choose from. So it may come down to what fits best with your A&P 2 and your comp class and your fine arts and literature and all that stuff.
Okay.
So.
Well, I think...
And Miss Valerie can certainly confirm that with you, and she knows that Miss Ray recommends, if you are pre-nursing, to just tackle 1 lab class in the spring prior to application, but if that's not what you intend anymore, I think she'll probably agree with me. If you're a fairly strong student anyway and you're not having too many issues dealing with the A&P 1 right now, A&P 2 is not like, it's not the same at all, as I understand it. It's, you know, I don't even know that they're prerequisites to one another. Like, it's totally different subject matter. So, you know, gauging your success or failure or struggle with A&P 1 may not be a good predictor of your success or struggle with A&P 2 either, because it's completely different material.
Yeah.
So, you're going to have to tackle it at some point if you pursue CLS.
That's
like I said,
true.
I mean, like the fall of your junior year is hardcore. I mean, I know like credit-wise, it's still just adding up to the routine 15 credits, but 15 credits of hell.
Yeah. I also saw these summers. Would that be something I could do back home?
Depends. Where in Illinois are you from?
I'm from Southern Illinois.
Okay.
I'm like 40 minutes from St. Louis.
Okay. How close are you to Poplar Bluff, Missouri?
A little further than St. Louis, but not like extremely far.
Okay. Because that's of our established relationships with hospitals, that's probably the closest one to you. We also have one in Kennett, Missouri, but that's further south. So it'd be, I don't know about establishing an affiliation agreement with a hospital near your home would necessarily work or not. It would depend, because the relationship that we have with a clinical site is from the college, not just our department. So it really becomes a matter of like legal related things where we have a specific written agreement that both parties have to sign and be cool with before we can send students there. I can see, you know, assuming you come this direction and we maybe have this conversation around your application time, which would give us almost a year lead time before you'd actually be going anywhere. I could see what the college has already established closer to that area, because I know we have clinical sites for other departments all over the United States. So if I go and discover, do a little search and see that we actually have, you know, several sites in Illinois, that all we'd have to do is modify the agreement to include CLS in addition to physical therapy or whatever is already out there. That would be a lot easier than establishing a whole brand new one.
Well, is that something that I would have to go to like every day, or?
Yes.
Okay.
So the way our summer sessions at ASU work is that we have 2 5-week-long summer sessions.
Okay.
And the only reason that we recommend summers is that it prevents you from having to stay another whole semester afterwards. So that's why we like to send people out the summer of their junior year, summer between junior and senior year, for a couple of rotations. Then while you're in your senior year, your classes with CLS are all online or web assisted, which means they require only a handful of meetings on campus. You can take a couple of your rotations at the same time as doing your classes, but you can't take all of them at the same time as doing classes, because you'd be like at 24 credits a semester or something crazy like that. And you'd probably go insane. So we recommend, you know, the summer between your junior and senior year to do a couple of rotations at that time to kind of lessen your load for your senior year when you're going to be taking all of those upper level classes at the same time as being on rotation. And yes, they are, what's required in that 5-week span of time is 168 face hours at the place, and that usually shakes out to about 4 weeks and 2 days of like work days, 8-hour days.
Yeah. Okay. Well, I think that's all the questions I have.
Okay.
I think we covered everything.
Well, and certainly if you think of something later, you know how to reach me.
Yeah.
You can send an email or something. We've got a whole